the truth is, and New Yorkers and all Americans deserve the blunt truth, it's only getting worse. And in fact, April and May are going to be a lot worse. Right now, we are a third of the cases in the country. That's going to get worse. We're about two-thirds or more of the cases in New York State. That's going to get worse. But Chuck, the President of the United States is from New York City, and he will not lift a finger to help his hometown. And I don't get it. I don't get it. Right now, I have asked repeatedly for the military to be mobilized, for the Defense Production Act to be used to its fullest, to get us things like ventilators so people who can live who would die otherwise. Chuck, I can't be blunt enough. If the president doesn't act, people will die who could have lived otherwise.
What is it that you want?
Senior citizens, folks who are members of families,
right.
And we can't get action from the President of the United States. Chuck, the military has extraordinary medical capacity of its own that's been honed in fighting wars. They can handle any situation. All military personnel who are medically trained should be sent to places where this crisis is deep, like New York. Right now, the American government is not at full bore right now. The Defense Production Act, it's been activated. We've gotten no indication of any factory on 24/7 shifts. We've gotten no shipments. And the U.S. military is at its bases instead of at the front line. So respectfully, Governor, we cannot be gentle about this point right this minute. From this minute forward, our government, our federal government needs to be in this fight instead of on the sidelines. I'm not worried about blame. I'm worried about saving lives right this minute, and I don't see the federal government at this moment. To the point at hand, Chuck, April is going to be worse than March, and I fear May will be worse than April. So bluntly, it's going to get worse, a lot worse, before it gets better. But what would be progress? Real, consistent social distancing, being enforced, people living with it, and hospitals that can function. People seeing that their healthcare system is actually holding because we have the supplies and the personnel. And I think that's going to be a national reality, Chuck. Personnel, medical personnel are going to have to be taken from one part of the country to another as this crisis deepens. The supplies, the equipment have to go where the need is greatest. If people see the system holding, that will be progress. If it starts to collapse, think about that in the United States of America in the 21st century, if our hospitals can't function because our government wasn't there for them.
People all over the place are working as hard as they possibly can to fight this hidden enemy. And it's going to take all of us, not only the local governments, the cities like the mayor and the state governments, all the governors, the federal government, but it takes every one of our citizens as a part of this, and we can't stop it without them cooperating. But it's going to be a while. We don't know how long or how bad it's going to be, but it's going to continue until we can get it stopped. And we're just going to keep fighting 24 hours a day until we can get it done.
All right.
Chuck, it's not true that people everywhere are fighting with all they got because our military is being sidelined and the White House is in denial. It's just not true, Governor.
Well,
I respect you, but that's just not true.
Well, we've got military all over our state doing all kinds of great things, like
You've got National Guard. You do not have the American
helping
military.
with hospitals, and building new hospital beds. And your governor in New York is doing the same thing, so maybe you ought to try to talk with him and see.
I have talked to him. It is not. Not everyone is doing everything they could do, Governor. Let's be honest about it.
So we're asking anyone so we have masks. Federal government has a stockpile of masks in the strategic stockpile. We get donations from around the country. We're ramping up production in commercial facilities. And what I'll say is, if you can find it on the open market, go buy it. So any governor that needs it and you find it, go buy it. FEMA will reimburse you under this emergency. We are shipping supplies every day. We shipped yesterday, we're shipping today, we'll ship tomorrow. It's fluid, it's dynamic.
But yeah, the social distancing is not being enforced, and it's a little crazy to see the kind of crowds at the cherry blossoms. I mean, people have to listen. There's people that are out there. I mean, you are endangering not only yourselves, but your fellow citizens by not listening to these warnings. We've been getting pretty tough out here in Maryland on folks, limiting people to groups of 10. We were chastising all these spring breakers that came back from partying in Florida, and we told them they need to self-quarantine for 14 days. Otherwise, they're risking their lives of their parents and their grandparents and their friends, because this no longer is just about older people. People of all ages. 40-some% of our cases are under 54 years old, and from 18 to 54. We had a 10-month-old, a 5-year-old who have gotten this disease. So the people are kidding themselves if they think that they should just go on spring break or enjoy being out there just as business as normal. We've got to get people off the streets and out of these crowds. It's absolutely essential.